Welcome. My name is Dr. Jeremiah Krieger, and it is a pleasure to be speaking to you today about the theoretical basis of Chinese medicine for the treatment of mental health issues. For over 20 years, I've been treating patients in Los Angeles, California using acupuncture and Chinese medicine. It still astounds me on a daily basis just how clinically useful this medicine is for my patients' emotional and physical well-being. I've had the good fortune of being affiliated with some of the leading academic institutions in the city and being able to practice inside hospitals. I've had some unique experiences like being able to practice in the emergency room where I have confronted mental health crises bedside. I've also had the good fortune of helping to set up mental health clinics using acupuncture, most recently one for severe PTSD and combat veterans, which I'm proud to report has been having some really life-changing effects for our patients. Chinese medicine is ancient. It stretches back 3,000 years. It is elegant and thoughtful and time-tested. It is a joy to share it with you, and I hope by the end of this talk you will have a much clearer understanding of its basis and how and when to collaborate with a doctor of Chinese medicine for your patient's benefit. My background is that I have a doctorate of acupuncture and Chinese medicine. I did a master's degree in psychology, and I did my undergraduate work at UCLA. It has been an absolute honor to participate in this medicine and to be a part of this training program. And without further ado, let's get right into the heart of this beautiful material. I hope you enjoy the presentation. Chinese medicine is truly ancient, with an over 3,000-year history. The earliest writings were found on tortoise shells in the 15th century BC, and the first full medical text, the Huangdi Neijing, or the Yellow Emperor's Classic, is about 2,200 years old. You see in the image to your left the mythical emperor sitting there reading his medical work. If you consider that Western medicine is at most 7 generations old at this point, and the staggering amount that has been learned, what is the value of over 150 consecutive generations, all working on, refining, and repeatedly testing the medicine? Chinese medicine I think of as the longest clinical experiment repeated over time in human history. Eventually, there were imperial colleges of Chinese medicine, which provided a place for continuity of learning, a repository for information, and consistent progression. As one begins to explore the ancient Chinese medical texts and to see what a sophisticated understanding they had of the body, it is a bit staggering how without modern scientific instruments, the ancient Chinese figured out so much about how the human body functions. They were great at organizing groups of physiologic processes and anatomical structures into categories and relating those to things like the seasons, the 5 elements, and human government, all means of conceptualizing the interrelationships of the body and the organs. The ancient Chinese found herbs that represent virtually every class of drug functionally. There were blood thinners, there were statins, there were natural antibiotics, there were opiate pain relievers, there were antacids, there were bowel purgatives, there were mood elevators. Virtually every category of drug you can think of in modern science had a herb equivalent, and now we have enough biochemical knowledge to understand the active ingredients in these plants and how they do what they do, many of which have actually led to the formation of drugs. Understanding that the body as a whole is greater than the sum of its parts and understanding the interrelationships therein is one of the strong suits of Chinese medicine. And it is a little bit different from Western medicine, where we have become very specialized and focused on a particular area as separated from the rest. The ancient Chinese really had a sophisticated understanding of the body. They understand functions of organs, like, for example, that the heart pumped blood and the lungs exchanged air, that the stomach received food and the intestines helped to digest it and move it through and out. They understood that pathogens attacked from the exterior of the body and penetrated inward. They knew that energy drove physiologic processes within the body. and they considered food as medicine, much like the plants that were used to treat illness, so too was food. And the ancient Chinese believed in preventing illness as a focus. It was inferior medicine if you waited for your patient to be sick. And a lot of the compensation in the earliest parts of this medicine were on the doctor keeping you well, not waiting for you to be ill. One of the first concepts we're going to explore in the Chinese medical schema is that of the three treasures, Jing, Qi, and Shen. You can think of them like the three fundamental aspects of a human being, and it's the core model that is used for health. To teach about them, we use a candle analogy, where Jing is the wax, Qi is the flame, and Shen is the light. In the next slides, we will go through each of these in detail. We'll start with Jing. Jing is the wax of the candle, and it is considered to be the most concentrated form of energy in the human body. You can make an extrapolation that a single drop of Jing is worth 100 or 1,000 drops of blood. It is very precious and concentrated. Jing determines how long you live. It governs growth and fertility, how quickly one ages, and I like to think of it like the foundation of a house. Lots of Jing means a strong, resilient constitution, a house that is hard to move or damage. Whereas someone born with weak Jing, it's like a house built on a shoddy foundation where a little bit of rain or too much wind can knock the whole thing about. Or going back to the candle analogy, a puny candle cannot withstand a lot of force and will not last long, where one that is thick and wide in its base may burn for hours or years. The idea behind Jing is that you're born with a certain amount of it, and it should be used sparingly. It's something precious and worth preserving. Qi is the flame of the candle. It represents the more short-term, immediate, and easily replaceable forms of energy. It's energy made on a daily basis by eating, drinking, breathing, and sleeping. The more qi you have, the more energy is available to run the body well and to adapt to the stresses and external demands of your life. If you have 100 units of qi a day and 150 units of demands, the difference is made up by using more Jing. Just like if the flame of the candle was to become larger, it will burn through the wax faster. So a very high currency was placed on doctors helping patients to have more qi so that they could spare their Jing and thus extend their lives and meet the demands of their health. There are many functions for qi. Qi transforms and transports. That's like saying it is the energy that drives physiologic process within the body. It is the motive force used to drive the blood through the vessels. It helps to hold structures in place to keep organs from prolapsing. It raises the fundamental structure of the human body as well as the mood. It protects. Wei Qi, for example, as you will see, is the immune system in Chinese medicine, and it keeps your body warm at its natural and best temperature. There are many types of qi that perform different functions within the body. Ying qi or nutritive qi is most closely associated with food. Wei qi or defensive qi is like your immune system. Zong qi is the pectoral qi that drives the heart and lungs. Source qi is most closely related to Jing or essence and nourishes the vital organs. What is the basic disease model? In its most simple form, it's where the energy of the body is blocked or imbalanced, excessive or deficient, symptoms will occur. Chinese medicine has an incredible respect for the innate intelligence and healing mechanisms provided by nature. Just like if you have a cut in your hand, you don't consciously manage its healing. There's a vast array of physiologic cascades and cells rallied to repair that tissue, but we don't consciously manage any of it. Chinese medicine believes that if you help to rebalance the energy of the body, you support its own homeostatic mechanisms in which it can do healing far more efficiently and effectively. Speaking of mental state, that brings us to the Shen, or the light coming off the candle. The Shen is the mind or spirit. It is consciousness itself, emotions, and thought. The Shen resides in the heart, and it is that which gives us our unique personality and our ability to experience our world as a conscious being. So, what is the relationship of Shen and health? The Shen can be thought of as an efficiency system. A peaceful Shen facilitates the reorganization and recollection of energy. Take two people and put them through the same stressful situation. One person takes the situation very personally, feels battered by it, loses perspective about it, dwells on it constantly, and experiences huge volleys of emotion. And at the end of it, they feel depleted and out of balance. Another person does not take the situation or other people's behavior personally. They keep a sense of humor about it. They are aware, but they're also very aware of the positive things in their life, and they treat themselves with a lot of compassion as they navigate it. That person can weather the same stress with relatively little energy lost and in good shape. An imbalanced Shen drives a lot of excessive thinking and worry, stress, and strong emotions, which essentially shotguns one's energy in a myriad of directions, dispersing and disorganizing it, driving physical and mental fatigue and illness. The goal is to strengthen a person's Shen such that their inner resilience and capacity to stay healthy, even when challenged, grows ever greater. Chinese medicine uses acupuncture, meditation, breathing techniques, Tai Chi to help support the downregulation of the nervous system and keep it balanced. A healthy Shen is one that is adaptive, resilient, peaceful, present, and clear. An imbalanced Shen is dysregulated and reactive, disconnected, fragile, agitated, and depressed, and all of the psychiatric DSM diagnoses would fall under a dysregulated Shen. One of the definitions of health in Chinese medicine is quite beautiful, and it's when the heart and the kidneys communicate. The kidneys house your Jing, which drives your creative ability, and your heart is representative of your gifts, passions, genuine interests, and joys. When you use your energy on a daily basis in service to your natural gifts and passions, health is fostered. So part of every Chinese medical intake is asking your patients, what are their hobbies? What do they love? What brings them joy? How much time do they spend engaged in them? And helping them to spend more time doing the things they love so that it fosters more health and resilience. Chinese internal medicine is based around pattern identification, using their medical schema according to the medical classics. When symptoms, tongue presentation, and pulse match a described pattern, you have a diagnosis. In the image on your left, you see an image of the tongue with the internal organs mapped out. Certain features about tongue diagnosis, for example, are very intuitive. If a tongue is very pale, the patient may be anemic. If the tongue is very dusky, they may have circulatory issues. If the tongue is quite red, they may have heat built up in their body. We will see in the next photo that shows just how different tongues can be. In these images, you can see just how much the tongue can vary and how it could be a useful tool in diagnosis. Take, for example, the tongue in the middle, which is pale, it is swollen and has teeth marks, it has a crack in the middle and a little bit of a red tip. Each of those things means something in Chinese medicine. As we go through a clinical case later, this is somewhat similar to what you'd expect from the tongue in that case. When you look at the tongue on the right, you see that it is dusky and it is red, it has no coating, and it has some deep cracks. Those are all signs of specific internal imbalances that, when confirmed with a pulse that matches and symptoms that match, you have a pattern. Without doubt, the most challenging part of Chinese medical diagnosis is pulse diagnosis. This is a system where the pulse is taken in 3 different positions at each wrist and at 3 different depths. It goes far beyond the standard Western pulse that is just checking predominantly for rate. You will see in the next image what they relate to. In this image, you'll notice that the organs have different positions along the radial artery of the wrist and are found at different depths. In the upcoming image, you'll see the different qualities that can be felt on them. The chart in front of you is an excellent example of the more than 30 different pulses a doctor of Chinese medicine is taught to feel for. It shows the depth at which that particular pulse is felt and the amplitude and waveform of the pulse. It includes descriptors like a pulse that feels like pressing your finger onto a guitar string, or a pulse that feels like running your finger across a twisted and knotted rope. For the purposes of mental health, every single DSM condition can have multiple etiologies. So let's take a patient with auditory and visual hallucinations and schizophrenia. If their heart pulse is slippery, rolling, and full, you have a patient with insubstantial phlegm misting the heart, which confuses the mind and spirit, causing it disorientation and the symptoms. But another patient with auditory and visual hallucinations could have a rapid bounding pulse in the liver position that is tight. That's a sign of liver fire, and that fire is agitating the Shen. The liver governs the eyes in Chinese medicine, so if there is an emphasis on visual hallucinations more than auditory, that further helps the diagnosis. So you can see how useful these are in terms of changing a patient's mental state if you can understand what is in fact causing their mind to be disturbed. For diagnosis, there was a very famous modern doctor of Chinese medicine named Dr. Shen, who partnered with a Western physician, Leon Hammer, and they started describing these pulses in detail. And Dr. Shen was famous because he would take a patient's pulse without letting them tell him what was wrong with them. He'd spend 15 minutes or so very quietly studying the pulse at its different positions and depths while taking notes, and at the end would tell the patient what he thought was wrong with them and confirm with them if his medical diagnosis based on their pulse alone was correct. I got a chance to witness him for a day, and I can tell you that he was staggeringly accurate and consistently accurate. So this system of diagnosis can be quite potent. While embracing the same core schema of Chinese internal medicine, there are dozens of effective approaches for intervention. Varied schools of thought evolved about which road to the destination is most effective. Picking the most efficient path lends Chinese medicine to both being an art and a science. There were many schools from which to choose. For example, the Earth School talked about the central role of digestion in health. If you could get a patient's digestive system properly absorbing and deploying nutrients, then the body could heal itself of almost anything. And if you were trying to differentiate what the pathology was in a patient, you could look to the 8 principles. Was this pathology existing on the interior of the body or the exterior? Was it excess, driven by things like years of eating too much and unhealthy foods, or deficient, that was driven by exhaustion and depletion from overwork? Was it hot or cold, yin or yang? They would look at different levels of intervention within the meridian system. Was this a problem that was orthopedic, that you could use a tendomuscular meridian to treat? Or was this something that was very deep within the body that you needed to use one of the extraordinary vessels to treat that formed first during fetal development? Or was this something that existed at the organ level, in which case you'd use the Zongfu meridians to treat it? Chinese medicine also found schools of thought that dealt with pandemic illness. There was a famous classic called the Shanhan Lung and another called the Wen Bing that were used for the treatment of febrile pandemics as well as cold-derived pandemics. Chinese medicine had a pretty good track record with helping to deal with these problems. In 2017, I believe, the Nobel Prize went to a female doctor who studied Qinghao, the Chinese herb used very successfully to treat malaria. She found the active ingredient in it, and it was turned into the leading drug to kill the plasmodium. Within Chinese medicine also, you will find microsystems, which are fascinating, where the entire body is mapped out onto the ear, and you can find practitioners that only use the ear to treat a patient or the hands and the feet to great regard and effect. All of this is to let you know that in 3,000 years, a number of different means of intervention were developed, all of them valid and all of them having their best time and place. I think of it like a road map where you have potentially 30 different roads to the same destination. Knowing which one has the least traffic, the lights in the right places, and is the most efficient is really part of the art that every doctor of Chinese medicine seeks to master. When it comes to Chinese medicine and mental health, the five-element system is held in very high regard. The five elements are wood, fire, earth, metal, and water. Remember that the ancient Chinese were extremely astute observers of nature and its cycles and interrelationships. They would study them and then extrapolate them, applying them to the interior of the body's physiology and to the psyche. In this case, each of these elements are associated with emotions and organs and meridians. The wood element, for example, deals with anger and frustration and governs the liver and gallbladder channels and organs. Clinically speaking, take a patient with extreme work stress who is developing signs of irritable bowel syndrome. We might call that the wood element overacting on the earth. The liver, in this case part of the wood element, is supposed to keep the qi flowing smoothly through the body. The extreme stress is stagnating the flow of liver qi, and that energy is piling up in the organ and channel. Eventually it gets to the point where that system can't bear the load it's carrying, and so it dumps it on its neighbor, the earth element, across the way, placing it on the spleen, the burden on the spleen and stomach. The spleen and stomach, being primary digestive organs, then begin to show signs of irritable bowel syndrome, and hence you have this pattern. So clinically, what you might do is treat the wood element by circulating the liver qi and pacifying the liver, while strengthening the earth element by nourishing the spleen and stomach. The net result will be that not only do the digestive systems symptoms decline, but the patient's mind and spirit returns to a much more tranquil state and they begin handling their stress better. Or take a more extreme example of bipolar disorder. When you have a patient in a manic phase, you could think of it as the fire element burning out of control. In which case, you want to sedate the wood element so that it stops feeding the fire, as well as sedating the fire element itself. Again, you might drain or relax the liver channel at the same time that you clear fire out of the heart and small intestine channels. Let's say that fire now has burned so extreme that the patient is flipping to the depressed state of the bipolar swing, and they are dealing with incredible depression and lassitude. In that case, you might want to strengthen the earth element, which feeds the metal element, so that the metal element regains some of its energy and loses some of its depression, and at the same time that you're tonifying the lungs and large intestine of the metal element to let go of that sadness and help the person regain some of their momentum and positivity. The important thing to get here is that this method of seeing the psyche and the different elements and interplays of emotions gives a practitioner a very concrete means of intervention through acupuncture and herbs, and even through exercises and diets that can have a very quick and effective clinical outcome. There are practitioners who dedicate themselves entirely to this view of medicine using the five elements, and they get great results. Another model used to treat mental health is that of the five spirits. It breaks human consciousness down into five different spirits and correlates them to different organs. we will go through the Shen, which is the chief of importance among them, and you can click through the rest of those slides, reading them at your leisure, and we will go over a quick clinical example. The first of the five spirits, and chief in importance, is the Shen, which resides in the heart and was thought of as the emperor. It connects to and coordinates with all the other officials of government to rule, and the other aspects of spirit are those officials in charge of different parts of our psychology. By knowing what each governs, the doctor can tell which spirit is out of balance and how to treat it. The Shen is a form of heart qi that is created by the union of the Jing of the parents. It allows the individual to be conscious of themselves, permits cohesion of the various parts of their psyche and emotions, and confers a sense of self. Clinically, we can differentiate different types of depression using this model, in this case the Hun versus the Jur. A patient who's depressed with a Hun imbalance lacks direction, doesn't know what they want to do, and that causes the depression. Patient with a Jur imbalance knows what they want to do and has direction, but has no energy and will to carry it out. There are over 360 acupuncture points on the body, mostly organized into meridians, or pathways of energy that connect to organs or form during embryology. Where these meridians come close to the surface of the body, you find acupuncture points, and each and every acupuncture point has a specific function. Let's take two examples in mental health. Pericardium 6, located on the wrist, is known as the inner gate of the heart. It is an excellent point for opening the gate of emotion, of stored emotion, to help the patient release the stresses and feelings that they are carrying within. Very often a patient will cry when that point is put in, and at the end report feeling very regulated and peaceful. Another aspect of the use of that point for psychology is in reinforcing a patient's ability to maintain healthy boundaries. The idea behind a gate is that it holds steadfast, keeping out things which are not healthy, and opens easily to let in things which are. Another point we can look at is stomach 36. It is the master point of digestion and known as a doorway to the earth. It is great for calming the mind and spirit, and when needled, it creates a heavy, tingly sensation down the leg towards the ankle and foot. It provides a grounding sense for the person, helping them to be present and integrated in their body. And just like it helps their physical digestion and assimilation of nutrients, it helps their psychological digestion of unprocessed feelings and experiences so that they can make sense of it and move forward. On a Western end, we know that acupuncture has a profound and direct impact on the central nervous system. If you look at the functional MRI studies that were associated with the battlefield acupuncture that the US military created, you will see that they calm the brain centers that deal with pain, stress, and trauma. We know that acupuncture releases endogenous endorphins and opiates, and that it creates neuroplasticity. So let's go from theory to practice now and take a look at how Chinese medical theory guides the selection and usage of Chinese medical approaches, specifically for a clinical case. In our first example, we look at a case of severe depression in a third-year medical student. This student is depressed and tired, struggling to fall asleep, is having disturbing, stressful dreams, difficulty concentrating, a poor appetite, notices less physical stamina, and that they bruise easily. Upon examining their tongue, you see that it is swollen, pale, with teeth marks, and probably has a red tip as well. Their pulse is slippery and deep, meaning it feels like a pearl running over a plate, but only when you press in deep onto the vessel, and their complexion is pale. The diagnosis here is spleen qi and heart blood deficiency. Let's take a look at what that means. The spleen and stomach are like a refinery, making energy and blood from the food that's eaten. If the spleen is weakened by too much thinking and worry, a poor diet, or too little exercise, all things that busy students often have to deal with, it has trouble creating the uplifting energy that not only holds anatomical structures in their place, like in this case keeping the blood in the vessels, hence the student bruising easily, but it's also what lifts the mood. If the spleen cannot generate enough energy and blood, fatigue, muscle weakness, and difficulty concentrating occurs. When the heart is deficient in high-quality blood, depression ensues. And further, since the heart regulates sleep, the patient can have trouble falling asleep and stressful dreams. It's important to note that in Chinese medicine, blood deficiency is not necessarily anemia. Sometimes it is, but sometimes it's a relative quality of the health of the blood. Think of it this way. If you have a patient that eats dense, high-quality nutrients and very few refined foods, their blood will not be anemic, but it will be extremely healthy and rich in quality. If you take another patient who eats nothing but McDonald's and drinks endless amounts of soda, they too might not be anemic in their numbers, but the quality of their blood is significantly poorer than the first. The stomach receives the food and drink, and the spleen is the refinery that turns it into qi and blood. However, when the spleen is weakened, it also creates byproducts, dampness and phlegm. The dampness then swells the tongue and leaves teeth marks. The inability of the spleen and stomach to produce enough rich, healthy blood creates a pale complexion and leaves the tongue pale as well. Spleen qi deficiency and heart blood deficiency both have specific pulse characteristics, which in this case are deep and slippery. As we go into the treatment for this patient, I want to talk briefly about the effects of acupuncture on the brain centers. We know using functional magnetic resonance imaging that acupuncture produces a deactivation of the limbic paralimbic neocortical network, or the LPNN, which includes structures like the amygdala, the hippocampus, the septal nuclei, the cingulate gyrus, and so on. All structures that have been shown to play a primary role in the regulation of emotion. Again, it also causes the body to release natural endorphins and opiates, which play a further role in regulating and mediating stress. For this particular medical student and their depression, we will employ specific acupuncture points that address the diagnosis they were given. Stomach 36 is the master point of digestion, helps the stomach and spleen to turn the energy, to create more energy from the food that is eaten and richer blood supply. It also helps to reduce the byproducts of dampness and phlegm that the body is creating. Spleen 3 is the source point of the spleen. It's like giving the spleen a bolus of energy to do its job better, including lifting and holding. In this case, lifting the mood up and holding the blood in the blood vessels. Spleen 10 strengthens the body's ability to create a richer supply of blood. Ren 12 is an acupuncture point located right over the stomach, and not only does it strengthen the stomach and all of digestion, but it helps to vent and clear any blocked and imbalanced qi that is built up there. Since the spleen governs the muscles, Tai Chi may be prescribed as it's both a form of gentle exercise and has a calming effect on stress. The patient will be educated about which foods strengthen the spleen and in what forms. For example, soups and stews are considered partially pre-digested and thus easier to make use of in the body. The patient will be told to avoid foods that burden the digestive system, like fried, greasy foods and heavy foods. The patient may be shown acupressure points they can massage at home to continue the benefits of the treatment, or given a moxa stick, which is the herb mugwort rolled into the shape of a cigar and burned, used to heat the points and activate them. Herb formulas, such as guipitong, will be used to strengthen the spleen, build blood, nourish, and calm the heart, will be prescribed. In its totality, all of these interventions will be seen to have a phenomenal effect at lifting the patient's depression and starting to resource them again. And clinically, within several treatments and within at most 6 to 8 weeks, there should be a very discernible benefit. Here you see how one DSM diagnosis, for example anxiety, has 7 different etiologies, which will result in very different acupuncture point prescriptions and herb prescriptions, making it clear that not everyone with anxiety is treated the same way. Lastly, we come to my favorite part of the medicine, the central importance of the relationship of the doctor and the patient. Chinese medicine was strongly influenced by Buddhism and Taoism, where medicine was seen first and foremost as an art of compassion. The doctor's strong and healthy mind and spirit alone should be a healing agent for the patient. It was incumbent on a doctor of Chinese medicine to be a profoundly good listener, present, and to foster a sense of trust and bond with their patient. It was recognized that no matter how brilliant the doctor, and this is true of East or Western medicine, no doctor can cure every patient of every disease. There is only one area a doctor can succeed at 100% of time in the delivery of medicine, and that is in caring. There is never a time that we cannot care deeply for the patient in front of us. If I have learned anything in 20 years of medicine, it is to never underestimate the power of kindness. A patient that feels seen, cared for, safe, and that trusts you will have a better result from any treatment delivered, whether it's a steroid shot or a pill or acupuncture. Good medicine mixed with kindness is what creates the most beneficial outcomes. The image on your left is of Sun Simiao, very famous ancient doctor of Chinese medicine, who emphasized the central importance of kindness in the delivery of healthcare. In the following slide, you will see his oath that many doctors of Chinese medicine take, much like the Hippocratic Oath of the West. Please read it at your leisure and enjoy. Please find some references for further study you might find useful. There is an article that was recently published in JAMA Psychiatry demonstrating the effectiveness of acupuncture for the treatment of post-traumatic stress disorder. It was conducted by some physicians at the Veterans Administration in Long Beach. Giovanni Maciocia, a great doctor of Chinese medicine and scholar and translator, wrote a book on the psyche in Chinese medicine, and there are more as you can see on this list. Here's a reference list of source materials, articles, and books that you can refer to that were used to make this talk. And here is a list of the images in order of appearance that you can refer to if you'd like to find any. Thank you for your time. It was a delight to present to you. You can find me easily on the web, and feel free to reach out if you have further questions. I wish you all the best in your future endeavors.